Welcome, everyone, and thank you for joining us for today's webinar, Vulnerability to Stress as a Risk Factor for Major Mental Disorders, presented by Dr. Anthony Grace, Distinguished Professor of Neuroscience, Professor of Psychiatry and Psychology, Department of Neuroscience, University of Pittsburgh. My name is Alexis Corrales, and I will be your moderator for today's event. We are delighted to bring you this educational web seminar presented by LabRoots. LabRoots is the leading scientific social networking website and producer of educational virtual events and webinars. Before we begin, I would like to remind everyone that this event is interactive. We encourage you to participate by submitting as many questions as you want during the presentation. Simply click on the Ask a Question box located on the far left of your screen and type your questions into the drop-down box. Our speaker will respond to your questions via email following the presentation. If you have trouble seeing or hearing the presentation, please click on the Ask a Question box to let us know that you're experiencing a problem. This presentation is educational and thus offers continuing education credits. Please click on the Continuing Education Credits tab located in the top right corner of the presentation window and follow the process to obtain your credits. Now, without further ado, please join me in welcoming Dr. Grace. I will now turn the presentation over to him.
Thank you for the introduction. What I'm going to be talking about is the work that we've been doing looking at animal models related to schizophrenia and other major mental disorders. Now, of course, when you talk about something as uniquely human as schizophrenia, something like that can't be exactly modeled in an animal model. But what we hope to show is by taking information from the clinical literature and going back and forth between the animal model and the clinical literature, we think that we can actually look at some of the circuitry and pathways and pharmacology that are common between the systems. Now, in talking with schizophrenia, one of the important things to focus on is the dopaminergic system. This is the dopamine system in the rat, consisting of the ventral tegmental area on the left and the substantia nigra on the right. Of course, in the primate, the ventral tegmental area is smaller. It actually moves over to become the dorsal aspect of the substantia nigra and the ventral aspect of the substantia nigra. The dopaminergic system has been linked to a number of disorders. We know that the substantia nigra dopaminergic neurons or ventral tear degenerate in Parkinson's disease. The most medial part of the ventral tegmental area that's involved in emotion or affect tends to have a role in drug abuse and depression. And schizophrenia tends to be the more lateral part of the ventral tegmental area that has a major involvement in things like salience and seems to be disrupted in schizophrenia. Now, in order to study this in an animal, what we want to do is to be able to record from the population of dopaminergic neurons. Now, how do we determine the overall state of activity of these neurons in the brain of a living rat? Well, we know we can record from single neurons, but that really doesn't give us a complete picture of what's going on, because we know some neurons are firing spontaneously and some are inhibited and non-firing. And the ones that are firing at different rates and patterns. So what we do is to pass an electrode through the ventral tegmental area in a preset pattern and count the number of neurons that we see firing spontaneously. And this is a measure of population activity. Then when we isolate a neuron, we see how fast it's firing, or its firing rate, and also its firing pattern. And we do this because all of these parameters are controlled by different circuits and have different behavioral impacts on the organism. With respect to firing pattern, dopaminergic neurons are known to fire in a slow, irregular firing pattern at baseline. But studies by Wolfram Schultz and others have shown that whenever an animal is exposed to behaviorally salient stimulus, dopaminergic neurons fire bursts of action potentials. So these bursts are really the rapid, phasic, behaviorally salient output of the dopamine system. Burst firing alerts the brain that an important event has happened. Burst firing is controlled by glutamatergic inputs coming from a brainstem area called the pedunculopontine tegmentum, or PPTG. This lands on NMDA receptors on dopaminergic neurons and causes the dopaminergic neurons to go into a burst firing mode. Now, the thing about NMDA receptors is the neuron has to be depolarized in order for them to be activated. If the neuron is hyperpolarized or non-firing, there's a magnesium block of the NMDA channel, so nothing happens. So only the firing neurons can burst fire. which raises the question about what causes or what regulates whether a neuron is firing or not. This seems to be potently regulated by the ventral pallidum. The ventral pallidum is a GABAergic area. It's the ventral aspect of the globus pallidus that provides a potent inhibitory input to the dopaminergic neurons to keep them from firing. When this area is inhibited, it removes this inhibition from the dopaminergic neurons and allows them to start firing at their normal rate and pattern. Now, what's the relevance of whether a neuron is firing or not? It basically provides a level of amplification of the system. So as I mentioned, the ventral pallidum controls whether it's firing. Pedunculopontine causes firing neurons to burst fire. Burst firing is the signal, but the ventral pallidum controls the gain, or the amplification of the signal. The more neurons that are firing, the more that you're going to get more neurons are going to go into a burst firing mode. And this system seems to play a major role, particularly in the psychotic symptoms of schizophrenia. Now, in order to try to understand this, what we used is a developmental neurotoxin, methylazoxymethanoacetate, or MAM. We know that schizophrenia patients, whenever the mother is in a dangerous or disruptive situation while pregnant, for example, when they're in an area of famine during the second trimester, when they have a severe influenza infection during the second trimester, there's a higher incidence of schizophrenic births, suggesting that this is really a critical or a sensitive period. So what we do is we give the MAM, a DNA alkylating agent, at gestational day 17, which is roughly equivalent to the human second trimester. We then let the rats be born, follow them through adolescence to adulthood, and see what happens. When we get to the adult, we see a number of things that recapitulate what we would expect for an animal model of schizophrenia. As far as the anatomy, we see a thinning of the limbic cortical structures, not a major thinning, only about 10 to 20%, about what you see in humans. And it's the same equivalent structures that you see thinned in human postmortem schizophrenia brains. But there isn't a loss of a large number of neurons. Instead, the neurons are packed closer together. So you lose neuropil rather than substantial loss of number of neurons. But one class of neurons that is lost are the PV or parvalbumin-containing GABAergic neurons that are seen in the animal model as well as in schizophrenia patients. We also see disruptions of behavior, such as sensory gating, like pre-pulse inhibition of startle, deficits in prefrontal cortical function or executive function, such as reversal learning or extra-dimensional shift, and impairments with respect to negative symptoms, such as latent inhibition and social interaction. We also find that the animals tend to be hyperresponsive to certain drugs, as are schizophrenia patients. We know, for example, that PCP or phencyclidine can mimic the psychosis that schizophrenia patients feel, and we also see an increased response in the rats. We also see an exacerbation of the locomotor effects of amphetamine in the adult MAM-treated rats. Interestingly, we don't see it pre-pubertally, which is consistent with schizophrenia arising in the late adolescent, early adulthood phase in humans. Now, the increased amphetamine response is consistent with a role for dopamine in schizophrenia. And we know that there's a lot of evidence for a role for dopamine in schizophrenia. All antipsychotic drugs in use today are primarily dopaminergic antagonists, or occupy dopamine D2 receptors. Drugs that release dopamine, such as amphetamine and L-Dopa, will worsen psychotic symptoms in schizophrenia patients, and if given at high enough doses, can mimic schizophrenia in normals. And we know that schizophrenia patients show an increased amphetamine-induced dopamine release. This is measured by looking at binding of radioactively labeled raclopride, which is a low-affinity dopamine antagonist, which can be displaced from receptors by endogenous dopamine. And what we find is a much greater displacement in schizophrenia patients, and furthermore, the amplitude of this increase correlates with the ability of amphetamine to worsen psychosis. So we have an identity between an overactivated dopaminergic system and at least the psychotic symptoms of schizophrenia. The thing is, despite years of looking, there hasn't been evidence for a primary deficit in the dopamine system itself. Instead, we now believe the dopamine system is normal, but is likely dysregulated by other structures. And one that's gotten a lot of attention is the hippocampus, which imaging studies in schizophrenia patients has been shown to be hyperactive, especially during the psychotic phase. So is the hippocampus hyperactive in the MAM animal as it is in patients with schizophrenia? Well, when we look at just firing of the ventral or limbic hippocampus, what we find is it tends to be firing significantly faster in the MAM rat compared to the controls. But what's interesting is not only is it firing faster, but its rhythmic activity is disrupted. Now, instead of the low-frequency rhythms that are necessary for gating information flow in other structures, these frequencies are lost and are replaced by an increase in higher frequency rhythms. So if anything, there's more high-frequency noise coming out of the hippocampus, overdriving postsynaptic circuits. Now, does this impact dopaminergic neuron activity? Well, when we look at our three parameters of dopaminergic neuron activity, number of neurons firing, firing rate, and pattern, what we find in the MAM animals is a nearly doubling in the number of dopaminergic neurons firing without a change in average firing rate or firing pattern. Now, this is actually consistent with what's been seen clinically. Studies by Howes and Maguire in London have shown that in ultra-high-risk subjects in schizophrenia patients, there's an increased fluorodopa uptake into dopaminergic terminals. Now, fluorodopa is a measure of metabolic activity that suggests that there are more terminals active in the schizophrenia patient striatum, which is consistent with our results showing more dopaminergic neurons firing and driving those terminals. So when the hippocampus is hyperactive, it can overdrive the ventral striatum nucleus accumbens. This then inhibits the ventral pallidum and causes the dopaminergic neurons to begin firing. Now, we know that this is occurring because of the hippocampal hyperactivity, because if we inactivate the ventral hippocampus, it brings the number of dopaminergic neurons firing back to normal without affecting the other parameters. And then when we look at behavior, the increase in amphetamine-induced locomotion we see in the MAM rats whenever we inactivate the hippocampus brings the amphetamine-induced locomotion back to the baseline control levels. So hippocampal overdrive leading to increased dopaminergic neuron population activity, we think is the basis for the dopamine hyperresponsivity that's seen in schizophrenia. Now, how does this increased population activity lead to the kind of symptoms that we expect to see in schizophrenia patients? Well, one thing that the hippocampus does is it's involved in context dependency, or the ability to adjust responses based on the context in which stimuli are presented. So, for example, if you're in a benign context, you're sitting at home in a safe neighborhood behind locked doors, you feel safe and nothing bad is going to happen. The hippocampus has the system toned down, so not a lot of neurons are firing. You then hear a noise outside. That noise, the behaviorally salient stimulus, activates the PPTG and causes burst firing. But because there aren't a lot of dopaminergic neurons firing, the dopamine signal is attenuated. So you might turn around, look out the window, and see what the noise was in a calm manner. But let's say you're in an activating context. You're walking through a very dangerous part of the neighborhood, that you're an animal out hunting where every noise is something that you might be able to eat or something that could potentially eat you. You have to be very vigilant to every stimulus that comes in. Now the hippocampus has the system toned up because of the activating context. More dopaminergic neurons firing. Now the same noise is going to cause the same PPTG activation, but because there's more neurons firing, you're going to get a bigger dopamine response. You're going to rapidly orient towards the stimulus to see if this is something that you could take advantage of or something that you need to escape from. But what about the schizophrenia patient? In this case, the hippocampus is hyperactive. It's overdriving the dopaminergic system so that all the dopaminergic neurons are active all the time, independent of context. Now, whenever there's a noise, whether it's salient or not, it's going to cause a massive activation of the dopaminergic system, which means now every stimulus is going to be activating the system as if it were a threat that had to be dealt with. And this is something consistent with what schizophrenia patients have reported. An excellent book by Ellen Sachs called The Center Cannot Hold: My Journey Through Madness describes her experience with schizophrenia as being constantly bombarded with stimuli where the filter that tells you what to pay attention to and what to safely ignore is broken so that everything is flooding in. It also can lead to an improper attribution of importance to benign objects. So, for example, if you look outside the window and see two strangers talking to each other, this is something you know you can safely ignore. But when a schizophrenia patient sees this, the dopamine system causes a massive activation as if this were a threat. And the patient has to come up with reasons why they're feeling this incredibly charged emotional response. So they confabulate that these are aliens planning to abduct them. This is the government spying on them. Something Satish Kapoor has referred to as aberrant salience, or the improper attribution of importance to stimuli that should be ignored. So when the hippocampus is hyperactive, the dopamine system is hyperresponsive to stimuli and results in overinterpretation of events. Now, as I mentioned, the ventral hippocampus is also involved in context dependency, which, as I mentioned, is also disrupted in schizophrenia. And in fact, when we look at this in rats, we also find a disruption. So, for example, if you have two contexts that differ in shape, in the tone being emitted, the color of light, and the odor of the two contexts, you expose one animal to a mild foot shock in context A and nothing in context B. And as you would expect, the rat exposed to the shock context would spend more time freezing, whereas when they're in the neutral context, they're not going to show much of a response. But MAM rats don't show a difference between the two contexts. Interestingly, this is the same thing seen in schizophrenia patients. In the bottom graph, you see that when people are put into a room where they've received a negative stimulus, the controls feel more uneasy in the areas where they had the negative stimulus compared to the neutral stimulus, whereas schizophrenia patients, just like the MAM rats, don't show a difference. So these data show that in the MAM model of schizophrenia, ventral hippocampal hyperactivity leads to a hyperresponsive dopamine system that we propose underlies psychosis. Why is the hippocampus hyperactive in schizophrenia? Well, one of the most robust findings that's been reported in schizophrenia is a loss of a particular type of GABAergic inhibitory neuron, those that contain the calcium-binding protein parvalbumin. This loss is seen in the hippocampus and prefrontal cortex of schizophrenia patients. And similarly, we also see a decrease in the prefrontal cortex and the ventral hippocampus of the MAM rats. So we see this regionally selective decrease in parvalbumin number. Now, how does this decrease in parvalbumin interneurons affect information processing? Well, parvalbumin neurons are known to affect high-frequency gamma rhythms. They're known to play a role in stimulus recognition and processing. And we know that there are a disruption of gamma rhythms in psychosis, in schizophrenia, as well as other disorders. So what we did is to examine whether activity rhythms evoked by conditioned stimuli that cause these gamma rhythms are also altered in brain regions where you see a decrease in parvalbumin interneurons. So to do this, we implant electrodes in the ventral hippocampus and medial prefrontal cortex and record local field potentials, and then break them up using a fast Fourier transform into delta, theta, beta, and gamma rhythms. We then expose an animal to either a neutral tone or a tone associated with the foot shock. And what we find in the normal animal is that the tone presented at the yellow bar causes a gamma activation in the prefrontal cortex and ventral hippocampus. But in the MAM rats, we don't get the gamma activation. So in areas where we lose parvalbumin neurons, we also lose the ability to get this gamma activation. So what I've talked about is the ventral hippocampus leading to an overactive dopamine system which we think underlies psychosis. But we know that schizophrenia is more than just psychosis. There's also the cognitive symptoms and the negative or affective symptoms. And what we find is that the ventral hippocampus also projects to the amygdala, which through the cingulate and orbital frontal cortex controls emotional responses. It also projects to the prefrontal cortex that's involved in cognition. So when the ventral hippocampus is hyperactive and dysrhythmic, it has the potential of pulling down this entire circuit to lead to all of the symptom classes of schizophrenia. So what we believe is that both in schizophrenia and the MAM model, there's hyperactivity in the ventral hippocampus, possibly due to decreased interneuron function. And if we inactivate the ventral hippocampus, we can restore normal dopamine function. Now, how can we do this in the dopamine system of schizophrenia patients? Well, right now, we think that antipsychotic drugs are doing this by acting on the dopamine system. The problem is, we think the site of the deficit is this loss of parvalbumin inhibition of the pyramidal neurons. But we treat schizophrenia by blocking dopamine in the striatum, which is 1, 2, 3, 4, 5 synapses downstream from where we think the problem is, which means that the antipsychotic drugs, which are really discovered by serendipity rather than any kind of planned synthesis, probably aren't the best mechanism for treating psychosis. A better approach would be to treat at the site of pathology. So this would involve the parvalbumin interneuron input into the pyramidal neurons of the hippocampus. Parvalbumin interneurons are driven by NMDA receptors, which is probably where PCP serves to worsen the psychotic phenomena. What we would like to do is to potentiate the effect of the remaining parvalbumin neurons on the pyramidal neurons. Now, we could do this by giving a benzodiazepine, which potentiates GABA. The problem is it's not selective, and we know that benzodiazepines are highly sedative. So a better approach would be if we could somehow get a more selective benzodiazepine. Now, benzodiazepines act on the GABA-A receptor, specifically on the alpha subunit. And there are 7 different alpha subunits with different pharmacologies. The alpha-1 and alpha-2 are the sedative subunits. But the hippocampus and amygdala are selectively concentrated with the GABA-A alpha-5 subunit. So what we wanted to do is to get a selective GABA-A alpha-5 benzodiazepine. And working with Jim Cook in Madison, Wisconsin, we came up with such a drug, one that very potently inhibits activation of the hippocampus, but at a different synapse, like the thalamic input to the cortex, even 10 times the dose doesn't have an impact. What about when we look at the dopaminergic system? Well, this drug doesn't seem to have much effect on control animals, but on the MAM animals, it brings the number of dopaminergic neurons firing back to baseline, and it also brings the behavioral response to amphetamine back to baseline. So it's basically normalizing all these parameters. Now, under these conditions, you might think, well, why aren't there studies being done by pharmaceutical companies to try to get these drugs into clinical trials? Well, the problem is a number of drugs that have shown promise preclinically have failed in the clinic. Lilly had an mGluR2/3 agonist bomaglutide that looked great in preclinical studies but failed in the clinic. Roche had a glycine uptake inhibitor that looked great in preclinical studies, failed in the clinic. Pfizer had a PDE10 inhibitor, looked great in preclinical studies, failed in the clinic. So drugs designed to work specifically on this deficit, although they've looked good preclinically, have all failed to produce clinically effective drugs. The problem is the difference in the way these preparations are treated. The first drug that the MAM animal sees is the test drug. But in clinical trials, they often take schizophrenia patients that have been on antipsychotic drugs for as long as decades, withdraw them for 1 week in order to wash out the drug, and then test the novel compound. The problem is such treatment with dopamine-blocking drugs are going to substantially alter the system. Specifically, by long-term blockade of dopamine receptors, you're going to get dopamine receptor supersensitivity. In fact, when we look at our MAM animals and give them just 3 weeks of the antipsychotic drug haloperidol, followed by 1 week withdrawal, what we find is our GABA compound that works so beautifully on the left, on the right, in the red bars, fails to impact the dopaminergic system. Even lesioning the hippocampus doesn't impact the dopamine system. And when we look at the behavioral effects, what we find is in the solid red bar, the normalization of amphetamine locomotion we see in the MAM animal. With 3 weeks of haloperidol in the red dashed lines, this normalization is completely prohibited. So haloperidol pretreatment has altered the capacity of the system to respond to a novel agent. Now, whenever you withdraw a dopamine blocking drug, the only thing that's going to work is another dopamine blocking drug, unless you can either get non-compliant patients or patients that are still at the early stages of their disorder and haven't received a long course of antipsychotic treatment. So in schizophrenia in the MAM model, interneuron dysfunction may be a primary driver of the symptomatology. And if we can restore interneuron function, we should have an effective treatment strategy. The thing is, we know that the presence of schizophrenia is bad for the brain. The longer the untreated psychosis, the worse the prognosis. A better approach would be as if we could prevent the transition to psychosis to begin with. Now, how can we do this? Well, there's evidence that stress can play a major causative role in psychiatric disorders. We know that stressful stimuli in patients with schizophrenia will exacerbate the psychotic symptoms of the disorder, and patients that are controlled by antipsychotic drugs that are returned to a high-stress environment are much more likely to relapse. Furthermore, studies by Eve Johnstone have shown that stress may play a role in the etiology of schizophrenia. In studies where she looked at a number of children that were at genetic risk for schizophrenia based on family history, she did a number of psychometric tests while they were adolescents, and then followed them up to see who converted to schizophrenia and who didn't. And what she found are the children that were hyper-responsive to stress early in life tended to be the ones that converted to schizophrenia. And the thing about stress is it can damage parvalbumin interneurons, especially early in life. The premise is in normal individuals, areas like the prefrontal cortex can limit the impact of stress exposure. But if this system isn't functioning, the deficits can initiate a cascade of events that magnify the effects of stress that we think lead to interneuron loss and schizophrenia in the adults. So in the normal adult, stress activates the mesocortical dopamine system, which releases dopamine in the medial prefrontal cortex, which feeds back and inhibits the stress response. But if this system is disrupted, it's going to disrupt dopaminergic system regulation. You're not going to get the prefrontal cortical down modulation of stress-related areas like the amygdala, which is going to magnify the impact of stress. This is going to activate the noradrenergic system in the locus coeruleus, which is going to contribute to stress, which will lead to hypothalamic glucocorticoid release, hippocampal damage, and so forth, in a positive feedback loop where stress causes damage, which causes more stress. Now, are the MAM rats more sensitive to stressors, especially early in life, before we're seeing any of the other pathology? Well, what we found is that whenever we look at measures of anxiety and stress in rats, such as the elevated plus maze. An elevated plus maze consists of open arms and closed arms that are elevated above the floor. Normal animals explore both the open and closed arms, but when an animal is anxious, it tends to hide in the closed arms. And that's what the MAM animals did. So they were anxious. Also, whenever an animal is exposed to a mild foot shock, it tends to vocalize. What we find in the MAM animals is they tend to vocalize way more to a very mild shock compared to the saline animals, which means they're more responsive to stressors. And furthermore, the basolateral amygdala, an area that we know is involved in stress regulation, is hyperactive in the MAM animal, which can also contribute to the anxiety. So all three parameters of stress and anxiety are elevated in the MAM animal. Now, if stress plays a role in the etiology of schizophrenia during development, this suggests that if we intervene early enough in susceptible individuals, we might be able to prevent this transition. So we tested this in the MAM animal by administering the anti-anxiety agent diazepam right before puberty, and then testing the animals as adults. What we did is to select a dose of diazepam that normalized behavior in the elevated plus maze and normalized amygdala neuron firing during this prepubertal state. We then tested it in the rats by giving them just 10 days of diazepam right around or before puberty, then waited till they reached adulthood and tested them. And what we found is that this blunted the loss of parvalbumin interneurons, and it also prevented the overactivation of the dopaminergic system in the ventral tegmental area, as well as prevented the amphetamine-induced hyperlocomotion. Now, of course, this suggests that diazepam given to someone before puberty has the potential of preventing this psychosis. However, not everybody that has a genetic risk for schizophrenia is going to develop schizophrenia later in life, only 10 to 15%. And we certainly don't want to give all these people diazepam. But a better approach would be to do other things that control stress. And one thing we did is to use environmental enrichment by giving the animals more social interaction, more activities, more exercise. And what we found that if we give them this prepubertal environmental enrichment, we actually prevented the activation of the dopaminergic system that we see in the adult. The converging evidence from clinical and basic science studies suggests the inability to regulate stress early in life can lead to pathological changes in the hippocampus that may underlie the emergence of schizophrenia in the adult. Now, interestingly, the fact that MAM can be circumvented suggests that MAM doesn't cause schizophrenia, but instead increases the impact of environmental factors on disease susceptibility. And what we posit is the same thing might happen for genetic predisposition to schizophrenia, that the genes don't cause schizophrenia. The genes cause an increase in the impact of environmental stressors on the hippocampal parvalbumin system. And it's this increased impact of stress that leads to the disorder. Now, if this were true, if an animal was stressed enough during this prepubertal period, we could get the same parvalbumin loss. So what we did is, instead of giving diazepam to normal rats during this postnatal day 31 to 40, we now took normal rats and exposed them to stress during the same period, either 3 sessions of restraint stress, daily foot shock stress, or combined foot shock and restraint. We then waited till they reached adulthood and did various tests. What we found is that giving them these stressors prepubertally caused the rats to be more anxious as adults. We also found that it tended to interfere with their ability to perform a cognitive task, such as novel object recognition, where they can't seem to tell the difference between an object they've experienced previously and a novel object that's taken its place. But only the combined foot shock and restraint activated dopaminergic neuron firing and increased the locomotor response to amphetamine. But interestingly, the increase was located exclusively in the lateral VTA. Now, this is important because the lateral VTA projects to the associative striatum, and the associative striatum are the places where you see increased raclopride displacement and increased fluorodopa uptake in the brains of schizophrenia patients. Furthermore, this increase in dopaminergic activity is persistent, seeing 1 to 2 weeks, 5 to 6 weeks, and 9 to 10 weeks after the prepubertal stress. And it's also associated with hyperactivity in the ventral hippocampus, both 1 to 2 weeks and 5 to 6 weeks after the prepubertal stress. We also see a loss in parvalbumin interneurons. Here we see on the top left graph a loss of parvalbumin neurons. In the center, we see a loss of perineuronal nets, which is a protective covering of the parvalbumin neurons. And if we look at parvalbumin neurons surrounded with perineuronal nets on the top right, we see a substantial and persistent decrease in both. So again, stress, we think, can lead to increased amygdala activity, could also lead to oxidative stress, as shown by numerous studies by Kim Do and others, which can together lead to parvalbumin loss in the hippocampus, hyperactivity in the hippocampus, and increased dopaminergic neuron activity. This is normally counteracted by the medial prefrontal cortex that can blunt the effects of stress on the basolateral amygdala. However, what happens if we interfere with medial prefrontal cortical function? So what we did is to lesion the prelimbic prefrontal cortex, an area that's involved in stress regulation, 5 days before the stress exposure. Now, this lesion of the prelimbic prefrontal cortex was enough by itself to make the animals more anxious. So they're as anxious as the MAM animals prepubertally with no treatment except prelimbic lesion. Now we find that foot shock alone, that was subthreshold for causing changes in the dopamine system, now caused a substantial activation of dopaminergic neuron firing and a big increase in the locomotor response to amphetamine. Now, what about if we do the stress exposure in the adult rats? Well, if we give the same combined stress to young adult rats and then perform recordings 5 to 6 weeks later, what we find is no change in dopaminergic neuron activity. However, if we recorded an earlier time point, just 1 to 2 weeks after stress, what we find is just the opposite, a decrease in dopaminergic neuron activity. But the decrease is now in the medial VTA. The medial VTA projects to the ventral medial striatum that's involved in motivation and reward. So this more resembles depression than it does schizophrenia. Now, why are prepubertal rats more sensitive to the effects of stress? Well, during puberty, we have a critical period where the parvalbumin neurons are getting excitatory inputs that are being made and broken and rearranged as the animal learns to deal with its environment. After puberty, there are molecular breaks that come into place that cause these perineuronal nets to form that lock in the plasticity, so they're not as plastic after puberty, but also prevents the neurons from damage. But you can actually reopen this critical period by several interventions. And one of them are HDAC inhibitors, or histone deacetylase inhibitors. The HDAC inhibitors can reopen the critical period. So what we did is to give an HDAC inhibitor, valproic acid, to the adult animal. We gave valproic acid for 15 days, with the last 10 days giving the combined stress. And what we find is without valproic acid, the combined stress decreased medial dopaminergic neuron activity, but with valproic acid, the combined stress increased dopaminergic neuron activity and caused a big increase in amphetamine-induced locomotion. Furthermore, this persists. If we look 5 to 6 weeks later, we still see the activation of dopaminergic neuron firing and the activation of amphetamine-induced locomotion. If we look at parvalbumin neurons, interestingly, 1 to 2 weeks after the stress, we see a loss in parvalbumin labeling in both the naive and the stressed animals. But in the naive animals, it recovers the baseline. But in the animals exposed to valproic acid and stress, it doesn't recover to baseline. It stays low and is maintained at a low level. Now, valproic acid has a number of actions besides being an HDAC inhibitor. It also interferes with GABA, or it also potentiates GABA. What about if we give a more selective HDAC inhibitor? Well, what we used is SAHA, that has HDAC inhibition properties, but it does not work on the GABA system and is not a mood stabilizer. And what we find is that the SAHA itself was enough to reopen the critical period in the adult and activate dopaminergic neuron firing. So therefore, the deleterious impact of stress, combined with factors predisposing an individual to the impact of stress, we think underlie the susceptibility to schizophrenia. And this is critically dependent on the timing of the stress. Exposure to stress during adolescence can lead to parvalbumin loss and schizophrenia, and exposure during adulthood when the parvalbumin neurons are protected, can lead to depression. And interestingly, schizophrenia and depression both run in the same families. And what we posit is the reason that they run in the same families is the common underlying variable is hyperresponsivity to stress. And when this is combined with stress either during adolescence, leading to schizophrenia, or in adulthood, it can lead to depression. And the increased response to stress, we think, may be mediated by a failure of the medial prefrontal cortex to limit the impact of stress exposure. So if we can identify individuals and intervene early enough, we might be able to prevent the deleterious effects of stress and the transition to schizophrenia. Basically, find children that are at genetic risk for schizophrenia based on family history, test to see whether they are hyperresponsive to stress in the prepubertal period, and then teach them to deal with the stress, either by giving them more social interactions, a more enriched environment, or by giving them a cognitive behavioral therapy where they can learn how to deal with stress exposure. And then to thank all the people in my lab who were involved in this work, Holly Moore, who developed the MAM animal in my lab, Dan Lodge, who did a lot of the work looking at the circuitry of the MAM animal, Stan Floresco and Tony West, who looked at hippocampal modulation of the dopamine system, Katie Gill, who did the work on the novel GABA drug, Yizhuan Du, who did the work on prevention of schizophrenia, Susie Sonnenschein, who did a lot of the work looking at the drug effects on schizophrenia, and Felipe Gomez and Jason Zhu, who did a lot of work looking at prepubertal susceptibility. And thank you very much for your attention.
Thank you, Dr. Grace, for that informative presentation. I would also like to thank LabRoots for making today's educational webcast possible. Before we go, I want to let everyone know that this webcast will be available for on-demand viewing through June of 2019. As a final reminder, our speaker will follow up with any questions you submitted via email. That's all for now. Thank you for joining us, and we will see you next time. Goodbye.